Hi everybody, it's Dr. Eric Balkavage and we're back for another edition of Thyroid Thursday. And today we want to answer a question that many of my patients have, and that is, why do doctors not want to run T3 or free T3? And the answer for this is, in the way most medical doctors are taught, conventional medical doctors, endocrinologists, is that T3 isn't that valuable in hypothyroid cases. Matter of fact, the American Thyroid Association guidelines says that T3 is rarely helpful in a hypothyroid patient since it's the last test to become abnormal. So TSH and T4 will become abnormal before T3 will. So docs just don't run it. They don't see a value in it. Most times they're looking to give you a T4 support and they're looking for TSH to start to normalize and T4 values normalize. So looking at T3 really isn't that important to them. Why is it that T3 is the last marker to become abnormal? And one of the answers is that biology of the body actually defends serum T3 to maintain a normal lab level. So in most situations, T3 doesn't really leave the lab range. Now, lab ranges are a bit broader range than functional range. Functional ranges, which we use in functional medicine or integrative medicine, we use a narrower, healthy range. And the functional range is really the range that the body works best in. Lab ranges are just a broader range. But T3 rarely ever, and free T3 rarely ever leave these ranges because the body fights to defend T3 at those within that range. And unfortunately, sometimes that's at the detriment to your cells. So your T3 in your serum doesn't necessarily equal the amount of T3 that's in your cells. So T3 can be normal in the serum, but it can be deficient in the cells. So T3 will defend, the body will defend T3 at a normal kind of lab range. It may be out of the functional range, but most times it stays within that lab range. But is it still important to do? In functional medicine, it is still really important to do, because if it is high or low outside the lab range or the functional range, we want to know that so we can understand why that's happening and understand how that is impacting our patients. But two, we can use T3 and free T3 in conjunction with something called reverse T3 to find out what's happening at the cellular level with something called the deiodinase enzymes. Now, I've talked about this on other videos. The deiodinase enzymes are the enzymes that convert T4 to either T3 or reverse T3, and T3 to T2. So it is really important to understand what's happening to that T4 that your doctor puts into the system. If you just look at T4 and you just look at TSH, we don't know if that T4 is being converted efficiently in our peripheral cells to active T3 inside the cells, or is the body or those cells converting it to reverse T3. So it becomes really important. So if we get our T3 test done and we compare that to reverse T3, we do kind of a ratio. If T3 divided by reverse T3 is less than 10, then we know we're making more reverse T3 in relationship to T3. That means the cells are increasing their deiodinase 3 to get rid of the T3, not send it into the nucleus to stimulate our metabolism. If we take free T3 and divide it by reverse T3, and that number is less than 0.2, again, that indicates that we probably have more deactivation of our T4 to this inactive hormone, reverse T3. So it becomes really important in functional medicine to understand what's happening at the cellular level, because thyroid physiology is really defined by what's happening at the cellular level. Your symptoms, your hypothyroid symptoms, your dry skin, your thinning hair, your tiredness, your fatigue is really a result of how much T3 is getting into your peripheral tissues. Most of the conversion for most of the cells of your body occurs in the peripheral cells. So once T4 is transported into the cell, it can then be acted on by deiodinases that convert it to T3, which can stimulate metabolism, or it can be acted on by deiodinases that convert it to reverse T3 and push it back out of the body. So most docs don't look at T3 because they don't think it's going to change too much, and most docs don't run reverse T3 because it's not as important to what they are trying to accomplish. The guidelines pretty much have doctors focusing on TSH levels coming back into normal range and T4 values coming into normal range. And it's assumed that if those two values come back into normal range, then you're getting sufficient levels of active thyroid hormone into the nucleus of your cells, and then your thyroid physiology is corrected or fixed. And that's just not the case. I've talked about that on multiple videos. Okay, so what do? You want to get T3, free T3, reverse T3 done. Your doctor doesn't want to do it. What do? Listen, it's your health. Ask them. Tell them you want it done. Tell them you'll take the responsibility. If it doesn't get paid, then you'll have to pay it. If you come to a functional medicine practitioner like me, you can get a full thyroid panel done for about $100, and that includes 9 or 10 tests regarding thyroid physiology. So TSH, T4, free T4, T3, free T3, reverse T3, T3 uptake, thyroid antibodies. So you can get a lot of testing done for about $100. So it's your life, it's your health. You want T3 done, tell your doctor you want to get it done. Don't just get T3 and free T3, make sure you get that reverse T3 number with it, and then make sure that you get the TSH, T4, free T4, T3 uptake, thyroid antibodies done as well, okay? But it's your health, ask your doctors or demand your doctors to run those tests, all right? Hopefully that helps. If you need help, give us a call at the office. I'd be more than happy to help you, okay? Take care.